Hello, my name is Dr. Diwan S. Raja. Today I will discuss about transient ischemic attack, also called TIA. What is transient ischemic attack? Transient ischemic attack is a cerebrovascular accident which resolves within 24 hours. This is transient and there will be ischemia to the brain as well as to the retina of the eye in many cases. So it will resolve within 24 hours. Most of the thrombotic stroke is preceded by transient ischemic attack. So if a person has thrombotic stroke later on, it is preceded by, in many cases, by transient ischemic attack. It is caused by embolism of platelet plaque, dislodged atheromatous thrombus from the carotid artery, from the vertebral basilar artery, okay, or from emboli from infected heart valve, or in sickle cell anemia, the sickle cell, the RBC cannot be flexible, so they may make plaque in the blood vessels that may cause ischemia in certain type of crisis due to sickle cell anemia. So what are the clinical features of transient ischemic attack? There will be headache, loss of consciousness, hemiparesis, contralateral motor and sensory loss, blurring of vision. There may be transient monocular blindness. That is called amaurosis fugax. And if it involves the posterior part of the circle of Willis, including the vertebral artery, basilar artery, or posterior cerebral artery, will get dysphagia, dysarthria. And also in TIA, we may also get language problem. Okay, so it may be involved due to blood supply to the speech area may be blocked. Usually from the middle cerebral artery, there is a branch of the internal carotid artery. Okay, so we got that. In a TIA or transient ischemic attack, symptoms are completely resolved within 24 hours without permanent deficit. You have to remember that this is transient ischemic attack. But this transient ischemic attack, eventually after a few days later, a few years later, there may be cerebrovascular accident or stroke. Complete stroke is possible. Okay, so if you look at the image here from the Microsoft PowerPoint Creative Commons, we'll find out there may be some type of dislodgement of atheromatous plaque may go there, or something from the heart may go to the brain, may block it, and this area may be blocked. Eventually that block is released, so it will be transient. Okay, so there will be flow is going to be blocked, then it will break down, so flow will again recanalized, so artery is temporarily blocked, gradually maybe build up like that way. Okay, so this is the transient ischemic attack. This will be resolved. It should be resolved by 1 hour, maybe within 24 hours. It should be totally relieved, and there should not be any permanent damage. Okay, so what are the workup or laboratory and radiological activity should be done by the physician in the emergency room? We look for the blood clotting, that is the function of blood clotting by assessing prothrombin time, partial thermoplastin time, PTT. We look for complete blood count, fasting blood sugar, because diabetes may enhance atherosclerotic changes and may cause also embolism. Lipid profile, high fatty diet may increase the serum cholesterol level, that may also stimulate atherosclerosis. Chest radiograph to find out any abnormality. ECG, there may be atrial fibrillation, so that may be the reason for embolus from the heart. Echocardiography, you have to find out any anomaly in the heart. CT scan of the head to rule out hemorrhage. This is not hemorrhage, this is ischemic condition, but we can do CT scan. MRI, magnetic resonance imaging. Magnetic resonance angiography of the brain is required to look any type of vascular changes, any congenital anomaly, any damage to the blood vessel. Okay, that will be outlined by these two. And carotid Doppler studies by ultrasonic technology. So anything block in the carotid artery, that should be found out, and it should be managed accordingly. We have the end arterectomy surgery if it is more than 70% of blockage of the carotid artery. It need end arterectomy. Okay. So therapy, how we manage a patient of transient ischemic attack, it depends on the cause, but these are very commonly applied. It should be done by the registered physician, specifically the neurologist. Anti-platelet therapy like aspirin or clopidogrel. Clopidogrel has some more advantage than that of aspirin. Aspirin dose may not be increased. Small dose of aspirin to the same like that of the large dose of aspirin in the prevention of transient ischemic attack. Anti-hyperlipidemic drug like statin group of drug may be applied if the serum cholesterol level is high and the lipid profile level shows something abnormal. Regulation of diabetes mellitus is very important. Management of hypertension, that may also lead to transient ischemic attack and eventually stroke. Modification of risk factor including smoking should not be done. Fatty meals should be avoided. Salty meal should be avoided to prevent the pathogenesis of hypertension, and substance abuse, very important. Substance abuse like that of amphetamine, cocaine, that will increase the blood pressure too high, that may lead to transient ischemic attack. Even that may cause the stroke. Okay, so substance abuse should be avoided. Maybe cocaine, maybe amphetamine, maybe even alcohol or LSD, that should be avoided because these sometimes may increase the blood pressure, especially cocaine, amphetamine. So that may lead to stroke and lack of perfusion to the cerebrum, cerebral ischemia. And management, one of the management is carotid and arterectomy. If the carotid artery, the common carotid artery or internal carotid artery is blocked more than 70%, then the surgeon take out that plaque from the blocked artery. And certainly health education, people should know that if they have TIA, then there is very big possibility to get the complete cerebrovascular accident. And the patient should maintain blood sugar level to the normal range and also prevent the hypertension, and they should continue on either aspirin or clopidogrel. And hyperlipidemic drug may be taken if their serum cholesterol level is high and lipid profile is altered. And that's all about the transient ischemic attack. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice day. Bye now.